Hey guys, it's Dr. Schulz. It is about 11:07, just after 11 o'clock at night on Sunday, April 26th. So this will be kind of our update for the morning. It'll be out there Monday morning. So kind of get into the numbers as usual. So as of this point, we're looking at worldwide 2,971,441 cases of COVID-19. So we're just shy of 3 million cases worldwide, with over 206,000 deaths. Here in the United States, we have 965,942 cases with 54,883 deaths. 24,967, so 25,000 of those cases are going to be in Texas. We are 11th when it comes to states still in terms of cases, with 600, and we have 651 deaths. And Harris County leads Texas with cases, with 5,628 cases and 84 deaths, 3,200 and change of those cases, and 42, half of those deaths are going to be in the city of Houston. We unfortunately recorded several deaths over the weekend in the city that have made that number come up. But one thing we got to look at now, so the other thing I want to talk about today a little bit besides the numbers is blood clots. And I know that doesn't sound like it makes a lot of sense, is why would we talk about blood clots when we're talking about COVID-19? But there's actually this weird thing, and it's starting to hit the news, and we don't have a great understanding for it, but we're seeing a lot of blood clotting in these patients. It started as some nurses in ICU saying, hey, I draw blood and the blood clots in the tube. Like, we can't get good samples of blood. And kind of trickled down anecdotally, though many of you all know I actually grew up in the Northeast outside New York City. I trained in New Jersey, so I still am talking to friends who are working in a healthcare setting where there's much higher rates of COVID-19 they're seeing regularly in Morristown, New Jersey, and in New York City. So I've talked to people there, and they say, yeah, blood just kind of clots. And they're seeing an increased number of patients with other clotting complications, and specifically patients who you wouldn't expect to see that in. So one example is a neurosurgeon out of Mount Sinai in New York has done some reports on large vessel strokes, right? So big, heavy strokes, dense hemiparesis, kind of the big one, right? The stuff that's in our protocols for large vessel occlusion, LVO alert, that kind of stuff. And in the last several weeks, they've noticed a 7-fold increase in LVO strokes in patients aged 30 and 40, 30s to 40s. And so, and it's caused a significant kind of stir that when they're looking at the strokes, the LVO strokes coming in, the average age of a patient who's COVID positive having a stroke is on average 15 years younger than those who are COVID negative coming in with a stroke just because they're having a stroke. It happens to be in the middle of the pandemic. But so what that's kind of saying is, there's this clotting thing going on. We're also seeing it with blood clots in the legs, DVTs. We're also seeing it in PEs, pulmonary embolus, blood clots in the lungs. There was just recently a news article about a Broadway performer in New York who had to have his leg amputated because of a deep vein thrombosis. Young, healthy, very fit, very athletic, no comorbidities. Came in with COVID-19, ended up going home with missing half of his leg. And so it becomes kind of a question as to why is this happening and why are we seeing this and what does that mean for us? So on the why it's happening, so there was also a report out of Wuhan in China a while ago, and there were some saying there were some more strokes, but it was largely looking at the older population, so it didn't give as much information. But some of these preliminary data out of the East Coast, New York, there's some out of Johns Hopkins, where they're saying, hey, you're having these 30s and 40s year old, otherwise healthy people with relatively mild COVID symptoms. So the traditional symptoms, the fever, the shortness of breath, the cough are relatively mild, but they're coming in suddenly with these big strokes. And one of the problems you're running into is they're also coming in later with their big stroke because they don't want to come in because they say, well, that's where the sick people are, right? You guys have heard this in the field. I don't want to go to the hospital. That's where all the virus is. But there's really kind of two explanations people are giving. One is that the body's immune response itself is at least in some part responsible. Whereas the body builds up an immune response, you have this cytokine storm you may have heard of, where the body's just kind of really firing on all cylinders trying to kill this thing. And part of that, it triggers the clotting cascade and you start getting blood clotting in inappropriate places or inappropriate times. The other thing is that there's some potential evidence that this may be a disease of the endothelium. The endothelium is the outside lining of a blood vessel or of the airway. So we see it in the airway because that's how most people get the disease. They breathe it in. But if it affects the endothelium and the blood vessels too, when you disrupt that endothelium, it provides essentially a place for clot to latch on, for clot to start forming, because your body sees a disrupted endothelium as an injury and it clots because that's what it's supposed to do. And then when you start getting clots in places where you don't need them, that's when you get large vessel occlusions. Things pop off, go to the brain, they pop off, go to the lungs, and you have these significant problems. So what you're seeing is young people, healthy people with no, it's not the 75-year-old diabetic hypertensive with 3 MIs now having their stroke. It's young, healthy people in their 30s, their 40s who have COVID but have mild symptoms who then suddenly have stroke symptoms. So what does this mean to us? It means it's really important that we dig in on two different levels. One, we need to not, and this should go always, but especially now, we need to not kind of say, well, that's weird that 30-year-old's he's not having a stroke, he's 30. It must be anxiety, it must be something else, right? It absolutely can happen anytime, but in the middle of this thing, it is a very real possibility that if you see strokes, if you see ST elevations on an EKG, if you've got someone who looks like they might have a pulmonary embolus, even though they have no risk factors, they're young, they're healthy, that's a very real possibility. The other thing is that if you get those patients who have strokes, you identify it, say, hey, this is a stroke, this is an MI, you also need to dig a little deeper and see if there's a COVID tie as well, right? Have they been ill? Have they had cough? Have they had fever? Those kind of things. Is there known contacts? Because that's going to be helpful for the hospital. But most importantly is just don't, and we should never be ruling out, right? Young people get strokes. It happens. Young people have heart attacks. We should never be ruling that out. But in this particular setting, I want you guys to be acutely aware that this is something that we're seeing happen with this disease. 7-fold increase in large vessel occlusion strokes. They're talking about several dozen patients where they normally would see 2 or 3 a month in that age category, that 30s to 40s age categories. They've got several dozen. And that's something it's a very real number. It's really kind of scary because we don't really know, that's us, right? That's you, that's me. That's the majority of people listening to this video. So make sure that you guys wear your PPE. Make sure you keep an eye out for this stuff, right? We know people are calling later in their disease process because they're afraid to go to the hospital. Encourage them to go if they need to go, but wear your PPE, protect yourself, be safe out there. I'll talk to you guys soon.